The health care reform debate is entering some uncharted territory. The Senate Finance Committee has pretty much wrapped up work on its bill, and now the House and Senate are preparing for historic floor debates. There are several Democratic ideas that are going to have to be reconciled somehow. But what about the GOP? Is it simply a party of no, as it's been criticized, or is there a plan on the right side of the aisle? Joining us now is Republican Congressman Dan Lungren of California. Thank you for coming in today, Congressman.
My pleasure.
Let's talk about this fact that there are at least 5 different versions now on the Hill out there. A lot of differences that have to be reconciled. How do you see them coming together, or will they?
Well, the whole question is whether or not the Congress is going to ignore the will of the people as expressed in the August town hall meetings and continuing town hall meetings around the country, or whether the Congress is going to listen to the American people. I hear this question about the Democratic plan, where's the Republican plan? Frankly, we ought not to be talking about a Democratic or Republican plan. We ought to be talking about the American plan. The American people have very clearly said they do not trust a public option. They don't want government taking over more and more of the health care that they desire. They want us to go back and look at very specific things we could do. And I think if you want to talk about more accessibility and you want to talk about trying to keep costs as low as they possibly could be, we need more transparency and we need more competition. There are innumerable Republican proposals, that is, proposals supported by Republicans that have been introduced that go to these questions, like having health associations where you could expand the number of pools that are available, being able to purchase insurance policies across state lines so you'd have many more of those available. What about litigation reform? That seems to be missing in every single major proposal we've heard from the leadership on the other side of the aisle, yet that's the very first thing the American people are saying when they're asked, would you do something about that because we think that could bring costs down and stop what's known as defensive practices of medicine. So there are any number of things that we on the Republican side have introduced, 32 separate amendments offered in the House bills, at least I think 41 separate bills out there. We'd like to be brought to the table, not so that we Republicans can stand up and say it's our plan, but we would like to say to the American people, your government is listening to you, you've expressed your point of view, we're not going to ignore you.
Do you think that's possible, though? Because I will say within the last couple of weeks, one of your Democratic colleagues sat right here in this chair, and I asked him, I said, you have the numbers to pass this without
Absolutely.
the Republicans. Will you do that if you don't get cooperation with, the major parts of this plan that you want? And he sat here and said, yes, we will do it without them. Is there going to be any bipartisanship in these bills?
Well, we're going to find out. They do have the numbers. They could pass anything they want tomorrow if it were called up. They do have the numbers. The question is, will they ignore the will of the American people? The most startling thing about the President's speech before the joint session of Congress a couple of weeks ago was his entirely absent reference to anything that had occurred in August. And it just didn't occur in August. It's continued through September. Talk to any member, any member of the Senate or the House who's gone home and listen to what the people are saying. That's the question. We're supposed to lead, but part of leading is listening first. And we're either going to listen to what the American people are saying and maybe check our egos at the door and say, maybe what we first came up with wasn't what the American people want. Why not sit down now, not with artificial deadlines, but go forward and show that we've got faith in the American people so they can have faith in what we're doing. And look, whatever we do is going to affect not just the American people today, but their children and their grandchildren. We owe it to ourselves and to them to get this right.
We know you've been doing a lot of hard work and much work still ahead, Congressman. Thank you for giving us part of your Sunday today.
Thank you very much.
Well, President Obama will hit the stump for some vulnerable Democrats in coming weeks.